afternoon. Last time we talked about classification and causes of mental disorders, and I said we can classify mental disorders into two major groups. We can classify them under neurosis and under psychosis. And I remember I did say neurosis has to do with the anxiety-related disorders, and I said psychosis has to do with real mental disorders that has symptoms like hallucinations, delusions, and disturbance in thought processes. I also said that we shall discuss more on neurosis. And I said we have like 5 types of neurotic disorders. I start by saying we have anxiety disorder as the first one. I said we have obsessive compulsive disorder as the second one. I said we have conversion disorder in the third one. And then I also said that we have manic depression or manic disorders, or manic depressive disorders. And then the last one, we have phobic disorders. I'll start by talking about what anxiety is all about. And I said anxiety should not be mistaken by the word stress and fear. Anxiety has to do with an individual response to stress. Then fear, it has to do with psychological processes. And I did mention the 4 types of anxiety: the mild, the moderate, the severe, and the panic anxiety. Also, when as far as talking about the types of phobias, I said phobia is an irrational, persistent fear associated with an object or a situation. I talk about 3 types of phobias. Say we have agoraphobias, which is fear associated with being in a place one is not safe, or the tendency of receiving help is not there. I talk of social phobias. People are afraid to do or perform in a social gathering so that they will not be evaluated negatively by their contemporaries and be looked down upon. And I talk of specific phobias. I said these are phobias that you have for some conditions or situations. For animals, for objects, for water, for space, height. And I know that I went ahead and discussed what is a conversion disorder. And then I went as far as talking about obsessive compulsive disorder. And I talk of an obsessive disorder as an external or intrusive thoughts brought upon an individual, which leads to a repetitive performance of a task that leads to the reduction of the anxiety associated with the task. Today, I will talk further on compulsive. That is where I stop. Compulsive disorder is a psychological disorder that is associated with making an individual doing a task compulsorily. You have an overwhelming feelings to do tasks repetitively, and the individual feel they must do so. For instance, such individuals have doubts. Those who have doubts in doing some tasks, for instance, individual with doubt, does he really actually close the door? You will now go back and check if the door is closed. Then maybe you will have doubt, maybe he has switched off the stove or the electric cooker. Then you go back to be sure. You need the assurance from other people to be sure. And then they have problems. Some of the signs and symptoms associated with the people that have obsessive compulsive disorders, signs and symptoms prevalent among these categories of clients are: 1, counting in a particular pattern. Take for instance, the person might be counting 1, 2, 3, 4, 5, and then start again from 1, 2, 3, 4, 5, or 5, 1, 2, 3, down from low to high, high to low. And these are conditions you see in such category of patient. So we are going to talk on depressive disorder. This is one of the neurosis, depressive disorders. We have one of it is manic depression. Manic depression, mania. It is a kind of a depressive disorder that has two poles. It has an alternating or swinging moods of high and low feelings. The patient will just suddenly be smiling, laughing. Within a shorter period of time, the person will just swing back into isolation or depression. So at a point in time, you see the person will have high moods, high and low. So high moods is mania, then low moods is what? Depression. So we call them bipolar disorders. Why we call them bipolar is because of the two poles, of the high and the low moods that is associated with this category of patients. So these are the 5 main groups of neurosis. Now, to expatiate more on psychosis that I talk about, I said psychosis is derived from the word psycho. And then psycho, we have the word psyche, which means mind. The psyche has to talk of the mind. So we can subdivide psychosis into two. We have organic psychosis, we have functional psychosis. So organic psychosis has to do with the disease that has to do with damage to brain cells, and it is characterized by it's a major mental disorder that has symptoms like delusions, hallucinations. And then I hope you know what is hallucination and what is delusions. When we talk of hallucinations, we could have auditory hallucination, feeling as if you're hearing some strange voices. You could have tactile hallucination, feeling some strange things moving in your body. You could have visual hallucination, seeing some strange images. You could have thought insertion. The patient will be feeling his thought is somebody is putting his thought. The thought he's thinking is not his own. And then we have thought broadcasting, where a patient will be feeling somebody is reading his mind. His thoughts is being read by some other people. It's not his thoughts. The thought is not his own. So these are types of psychosis. And then we talk of functional psychosis. Functional psychosis, they are mental disorders that actually issues that is not really related to brain damage. The mental disorders that occur that there is no trace of brain damage. We have in the neurosis, we have, that I mentioned before, we have the hypochondriasis. I told you hypochondriasis are a group of neurotic disorder in which a patient actually exhibits some symptoms of mental disorder without the real diagnosis of a medical condition. Take for instance, somebody who just over monitoring his body or skin, and then see some rashes here, will just feel I have cancer, even in the absence of medical diagnosis that will confirm that he has cancer. So these are some of the conditions. So hypochondriasis, those who have disease condition called hypochondriasis are called hypochondriacs. So hypochondriacs, because the over monitoring of their body and self-examination, they do come up with self-diagnosis of themselves and feel they have this particular disease. So we now talk of, under psychosis again, we have psychosomatic disorders. Now in psychosomatic, psycho has to do with brain, somatic has to do with body. So disorders of the brain disease that affect the brain that also issues with some physical bodily symptoms. Then we have such conditions called psychosomatic disorders. Now, in our discussion, under depressive disorders, we gotta have some depressive disorders like schizophrenia. We go have schizo. Schizophrenia is derived from the word schizo, which means split. Phrenia means mind. So schizophrenia is just a word that means split of mind. A schizophrenic patient could have a split of mind, in which such patients could have suicidal tendencies. They could feel hopeless, they could feel helpless, they could feel worthless. So these are conditions that actually comes up as a result of worrying and then anxiety. These are neurotic disorders that you need to know. They actually do not come from any damage to an organ. These are just psychological feelings. They are just reactions to the disturbance in your body equilibrium. Once you are disoriented because of a threatening situation, which leads to a shift in the equilibrium, then you could have these conditions. How do I know if a patient is having this challenge? You can see if a person is having this challenge when there's a deviation from the observed normal pattern of the behavior of the person over a period of time. Say, for instance, the person used to undergo activities of daily living, getting up early, bathing and going to work, and then suddenly you discover somebody has switched off or has changed from doing the normal activities of daily living by repeating a task, getting up in the morning and then bathing, sitting in a particular position, leaving that place, getting on again, bath, come back, sit in a particular position and refuse to eat, and is looking wasted each day. Then we need to know that there is a problem. So we could also have depressive illnesses. Depressive illnesses is also a neurotic disorder that could come as a result of depression. Depression will also come as a result of anxiety. Take for instance somebody who actually have gone to sell all his houses, all his assets, and borrowed money in the bank with the assurance that you will win an election. Suddenly you lost the election. You don't expect anything from such a person than to present with physical symptoms of worrying, anxiety, that might disrupt the normal functioning of the person and affects him and makes the person to be agitated, make the person to be restless, make the person to be impulsive. And when it gets worse, the person will develop some psychological symptoms like insomnia, lack of sleeping in the night. The person will have loss of appetite, increased BP or elevated BP. And all these conditions could aggravate into a depressive illness. If not curtailed, the person might attempt suicide. It could be suicidal attempt. That's why people that have depressive illness, they could have low libido. Of course, you have low pleasure for sex, you have reduced appetite, you have loss of weight, withdrawal, you withdraw from people and then you see them seated alone and bemoaning their fates, thinking. They may even lost insight. What I mean by loss of insight is they might even not know that they are even sick. They might think they are normal, but in actual sense they are sick. So all these are neurotic disorders. So summarily, when we are talking of classification of psychiatric and mental health disorders, just see them majorly under two: neurosis and psychosis. We talk of neurosis, talk the 5 I've mentioned. Other illnesses